Welcome to Overjet, the world leader in dental AI. My name is Dr. Gordon Barfield, Senior Clinical Manager here at Overjet, and I'm excited to walk you through how our dental AI platform helps clinicians diagnose more confidently, communicate more clearly, and elevate patient care. Overjet is an FDA-cleared, real-time clinical decision support tool used by tens of thousands of clinicians and the largest DSOs in the country. It analyzes every X-ray in near real time, usually within seconds, to detect and outline caries, calculus, bone levels, periapical radiolucencies, and more. Our industry-leading AI outlines the exact size of findings, and our AI supports patients ages 4 and up. Overjet was built by dentists for dentists, with the largest clinical and machine learning team in the industry. More than 75,000 clinicians trust Overjet to bring accuracy and consistency to their diagnostic workflow. Let's start with what you're seeing here. This is a bite wing X-ray fully annotated by Overjet. Caries are outlined in red or gold, with enamel clearly shown in white so you can see the DEJ. Calculus is highlighted in orange. Bone levels are automatically measured and color-coded. Green for healthy, yellow for areas to watch, and red where treatment may be indicated. And with automatic AI image enhancement, you can improve clarity instantly with one click that removes background noise on your image and ensure you're looking at the highest quality image available. Here's a periapical X-ray. A periapical radiolucency is automatically highlighted on tooth number 19. Prior restorations appear in blue and dental caries in red. This automated finding of critical signs of potential problems in asymptomatic patients can be the difference between early detection and an acute flare-up. It's easy to see how impactful the color-coded annotations are both for diagnosing clinical disease at its earliest stages, but as importantly in conveying the information to patients or guardians. In this clinical case, we see Overjet AI not only indicating potential disease, but quantifying it. The decayed, missing, and filled score becomes vitally important to convey severity, both to patients to drive case urgency, but also for alignment with payers when consideration for more complex indirect restorative procedures are planned. These FDA-cleared annotations tell a compelling clinical story and help ensure you never miss important information. One of Overjet's most powerful features is the Lens case presentation module. With Lens, you can place two images side by side, often from differing time points, to show progression clearly, whether you're demonstrating growing decay, bone loss, or a failing restoration. Lens turns clinical history into something patients can easily understand. Navigating to the odontogram allows the user to display every related image for a given tooth, whether an intraoral radiograph, extraoral radiograph, or IO photo, which allows a comprehensive view of your patient's oral health. In this example, Overjet Lens is presenting a comprehensive view of tooth number 7. Overjet gives you full control during patient presentations. Turn all findings on or off. Findings on or off. Using the space bar to quickly switch between clean films and AI annotated films. Additionally, individual findings can be toggled on or off. This allows a highly customized narrative to be created for the patient that you're treating. Overjet's built-in image adjustment toolset facilitates image adjustment with a simple mouse click from right within the image canvas. Use the precise built-in measuring tool to validate your diagnosis, estimate working lengths, or measure for critical aesthetic proportioning. All of this allows you to present treatment recommendations with confidence and ensures patients can see what you actually see. This black and white radiograph makes perfect sense to clinicians, but not to patients. Overjet allows you to finally tell a story your patients can clearly visualize and understand. Turn on the AI findings, and suddenly the patient can clearly see caries that require restorative treatment, areas needing better home care, bone loss indicating periodontal disease, and calculus contributing to inflammation. This clarity leads to higher case acceptance, better patient trust, and improved oral health outcomes. Beyond real-time AI, Overjet also provides operational intelligence for your practice. When we integrate with your office, we analyze 12 months of historical radiographs and compare AI findings to your treatment plans. Any finding that does not have a corresponding diagnosis or procedure is flagged and presented on one of two Insights dashboards. Let's take a look at the Restorative dashboard. Here you'll see crowns with recurrent decay but no scheduled replacement, interproximal carious lesions that weren't treatment planned, DMF findings that meet insurance criteria for full coverage. This becomes a powerful tool for uncovering missed care opportunities. And now on the periodontal dashboard. This shows you one of the most crucial aspects of Overjet, which is the scaling and root planing card. This card is defined as patients who have elevated probing depths and radiographic evidence of bone loss measured by AI, but never had scaling and root planing performed or scheduled. Those who are identified as an SRP opportunity meet insurance requirements to perform this treatment based on bone level measurements that are greater than 3 millimeters, pocket depths indicating inflammation greater than 4 millimeters. You can drill into each patient, see affected teeth, review the radiographs, and quickly see which areas meet insurance criteria for SRP to effectively treatment plan. To simplify your day-to-day workflow, everything rolls up into the Daily Patients page. This highlights patients on today's schedule who may need attention, based upon real-time AI findings like caries, calculus, or parl. This is what our AI is identifying as missed treatment opportunities, not just unscheduled treatments. Patients who are due for perio charting are flagged along with callouts for those who may be due for screening x-rays. Younger patients have their x-rays evaluated by AI, and when appropriate, a due for sealants recommendation is given. Abnormal findings on historical x-rays are flagged for clinical consideration, and any findings derived from new images are populated into the findings column. You can filter by provider or operatory and click directly into images with the findings. This becomes the go-to workspace for hygienists, office managers, and dentists preparing for the day. Overjet was designed to fit seamlessly into your existing workflow. You keep your PMS and imaging systems exactly as they are. The only change is that you now view your x-rays through Overjet's cloud-based platform so you can assess real-time artificial intelligence. AI is transforming dentistry by giving clinicians greater accuracy, more confidence, and a better way to communicate with every patient. Overjet helps you deliver clearer diagnoses, higher case acceptance, and more consistent care every single day.